Every morning, it's the same routine. You wake up and your lower back feels tight, achy, heavy. It takes a moment before you can swing your legs out of bed, and even longer before you feel steady enough to stand. You might chalk it up to sleeping the wrong way, or maybe you think it's just age catching up with you. Well, here's the thing. Lower back pain isn't just a normal part of getting older. It's something almost all of us experience, at least once in our lives. And for over 23% of adults worldwide, it turns into a chronic, daily struggle. So, what exactly is happening in your lower back as you age? And more importantly, what can you do about it? Let's start with the basics. Your lower back, also known as the lumbar spine, is one of the most important regions in your body. It supports the weight of your upper body. It stabilizes your spine, and it allows you to move freely to sit, stand, bend, twist, and walk. Think of it like the foundation of a house. When that foundation shifts, even a little, everything else starts to feel the strain. The lumbar spine is made up of 5 bones, called vertebrae. Between each vertebra is a soft, cushion-like disc. These discs absorb shock, help with movement, and protect the bones. Surrounding all of this are muscles, ligaments, and nerves. They work together to help you stay balanced and upright. But here's the problem. As we age, these structures begin to break down. Discs lose moisture. They become thinner, less flexible, and more prone to damage. Muscles around the spine get weaker. Ligaments lose their elasticity, and the bones themselves can become brittle. It's a slow process, but it adds up. And one day, even a small movement like bending over can trigger pain. Understanding how the lower back works is the first step in protecting it. So why does lower back pain become more common as we get older? Well, the answer isn't simple, but it is clear. Your body changes, and your lower back feels the effects first. One of the biggest changes happens in your spinal discs. These are the soft cushions between your vertebrae. They help absorb impact and protect your bones. But over time, they start to dry out. They lose flexibility, and they shrink. That means less cushioning, less support, and more pressure on your joints and nerves. This is called degenerative disc disease, and it's one of the most common causes of chronic back pain in older adults. Then there's muscle loss. As we age, we naturally lose muscle mass, especially in the core, the muscles that support your spine. Without strong core muscles, your lower back has to work harder, and that extra strain can cause pain, tightness, and even injury. Posture also plays a big role. After years of sitting too long, standing unevenly, or lifting things the wrong way, tiny injuries build up. They may not hurt at first, but slowly they wear down your joints, muscles, and nerves, until one day it hurts just to stand. And then there are more serious issues. Conditions like osteoarthritis can cause joints in the spine to break down. Spinal stenosis, a narrowing of the spinal canal, can press on nerves. Spondylolisthesis, a vertebra slipping out of place, can change your entire spinal alignment. And in women especially, osteoporosis becomes a concern. Bones weaken, and small fractures in the spine become more likely. You might not even know it happened, but you'll feel the dull, aching pain for weeks or months. And here's something most people don't realize. Back pain doesn't always come from something obvious. You don't have to fall or lift something heavy. Sometimes all it takes is a sneeze, or reaching for a glass on the top shelf, or turning the wrong way in bed. That's because the damage builds up slowly, year after year, and eventually the smallest movement can become the final straw. So if your back hurts more than it used to, it's not just in your head. There's a reason, and understanding that reason is the first step toward real relief. Now let's talk about something important. When should you be worried about your back pain? You see, most of the time, lower back pain isn't dangerous. It might be annoying, frustrating, even painful, but it's often caused by minor strains or sprains. Maybe you twisted too quickly, lifted something the wrong way, or sat too long in a bad chair. And in those cases, a little rest, movement, and time is all you need. But sometimes, back pain isn't just a nuisance. It's a warning sign. So how do you know the difference? Well, here's what I tell my patients. If your pain is sharp, sudden, and makes it hard to move, pay attention. If it radiates down your buttock or down the back of your leg, that could be a sign of sciatica or nerve compression. If your legs feel numb or weak, or if it's hard to lift your foot when you walk, that could be something more serious. You should also watch for pain that gets worse at night, or pain that doesn't go away after 2 or 3 weeks. If you're waking up in pain every morning, or you feel stiff and locked up until midday, your body is trying to tell you something. And if your back pain comes with other symptoms, like fever, chills, or unexplained weight loss, don't ignore it. Have you ever felt lightheaded or faint along with the pain, or had trouble going to the bathroom? Those could be signs of something much more serious, like an infection or pressure on the spinal cord. And here's another thing. If you've had cancer in the past, or if you're over 55 and the pain has no clear cause, it's time to check in with your doctor, even if it's just to be safe. Because while most back pain isn't life-threatening, some cases need medical care right away. And honestly, you don't have to wait for a red flag. If your pain is keeping you from doing things you enjoy, like walking, gardening, sleeping, or playing with your grandkids, that's reason enough to get help. Pain that interferes with your life is not just part of aging. It's a signal, and you deserve answers. You deserve relief, and you deserve to live without constant discomfort dragging you down. So listen to your body. It's smarter than you think. And when something doesn't feel right, trust your instincts. Here's the truth. You don't have to just live with back pain. It's not something you have to accept as the price of growing older. You can take steps, starting today, to feel better. And the very first step is understanding what your body is telling you. When you know the root of the pain, you can finally begin to heal, not just cover it up, not just push through, but actually move toward relief. In the next video, we'll talk about 3 everyday habits that quietly make back pain worse and what you can do instead to support your spine. Small changes really can make a big difference. So stay with me. You're not alone in this, and your strongest, healthiest years might just be ahead of you.